At ReadyMind, we offer a comprehensive solution that brings together cosmetic practitioners and psychologists. And what we're really passionate about is creating patients who are the most satisfied with their cosmetic treatment outcomes.
And we all know there's nothing more gratifying than having a patient who is really pleased with the outcome of a cosmetic procedure. They love the way they look, they feel good, the professional feels good. And the majority of the time, this is what happens when someone gets a procedure. But not all the time. And what ReadyMind is about identifying those clients that might not get that positive outcome. And so what we sought to do with ReadyMind is give cosmetic professionals, surgeons, nurses, doctors, a tool that they can use to predict which of their patients are going to get the good results.
We do this with our ReadyMind assessment tool. In just 5 minutes, you can give your patient a questionnaire to complete in the waiting room, either on their smartphone or on an iPad, that helps to assess their mindset before getting cosmetic surgery or a cosmetic procedure. This assessment tool assesses a range of different factors. It assesses their emotional readiness for the procedure. It assesses the presence of body dysmorphic disorder symptoms. It looks at their expectations and their motivations for cosmetic treatment, so what they're hoping to achieve through the procedure. And it also assesses their coping resources to determine how well this person might cope through the challenges that could come with cosmetic surgery or during the recovery period. You'll get an instant report that will tell you whether your patient is in the red, yellow, or green zone. If your patient is in the green zone, this is great news. It means they're in the right mindset to proceed with cosmetic treatment, and they're most likely to be satisfied with the outcomes. For patients in the green zone, it means they've got realistic expectations of treatment, and their emotional well-being is in a good and stable position to proceed with treatment. If they're in the yellow zone, this means that the patient is exhibiting some areas of concern, which might increase the risk of dissatisfaction with treatment. In this zone, our report will give you some recommendations of areas that you might need to educate your patient on a little bit more before going ahead with the cosmetic procedure. And it will also give you some tips on how you can design your informed consent process. If your patient is in the red zone, that means that they're exhibiting several concerns that could increase the risk of dissatisfaction with cosmetic treatment. For patients in the red zone, we'd be recommending that you refer them on to a mental health professional for further assessment and a discussion of their goals and motivations and expectations for treatment, so that the mental health professional can work together with your patient to determine if now is the right time to proceed with the cosmetic treatment, or if they might benefit from further counselling before, during, or after cosmetic treatment to help them get the best outcomes.
So my hope is that when practitioners start to use ReadyMind, that they'll be able to identify which of the patients are going to get the best results, and also be able to predict with confidence the patients that might not be satisfied. ReadyMind helps protect the practitioner. It's part of a holistic package for a patient where they're looked after medically and psychologically. And it helps us understand a risk that we might not have been able to identify before a tool like this existed. And it's been really great working with so many cosmetic professionals who have known for years that there's something about patient mindset which is so important during initial assessments with patients. And so ReadyMind has really just clicked because it makes sense to predict patient outcomes in this way.